I'm delighted to welcome you here this morning. And I'm particularly impressed that we were able to bring together just a real cross-section of our community, from the investor community, from the nonprofit community, from the government sector. It's an important kind of mix today to have a conversation about a new idea that may take hold here in new and different kinds of ways. So as Michael said, I had the privilege and honor of going back a couple years ago to Cambridge to spend a day with Dr. Clay Christensen out of the Harvard Business School, who has developed this notion and this theory of disruptive innovation. And at that time, he was previewing his book, the Innovator's Prescription, which was really looking at healthcare reform before the Affordable Care Act was even kind of on the radar as a possibility. And so he was looking at how could we take this notion of disruptive innovation and apply it to the healthcare sector. And as I returned to the Valley after my day with Dr. Christensen, I was a little bit confused in the sense of like, it doesn't really fit us in terms of healthcare reform itself. But there's got to be something to this that we can figure out a new way of working, a new way of looking at some pretty old problems. And so Dr. Christensen's health was ill for a while, and he got better, and we were thrilled by that. And about 2 years ago, almost 3 years ago now, January, we asked Dr. Christensen to come out, and we brought him out here from the Harvard Business School to spend a day with us. And we, again, brought people together from mostly from the philanthropy side. We had lots of our major partner agencies and foundations that fund the work that's done in the social services sector here, in addition to the nonprofit sector. And we pulled people together to listen to Dr. Christensen lecture on disruptive innovation. We brought the Harvard Business School to Silicon Valley for a morning, and then we spent the afternoon really trying to struggle with what might these ideas look like, what might be disruptive, what might be innovative here in the Valley, as we studied a lot of different sector issues across the board. At the Health Trust, we look at the health issue and the health and wellness issue in a very broad way. We look at the social determinants of health, the things that really make people unhealthy, as opposed to the downstream solutions, which is what are we going to do once you already are sick? And if you're looking at that kind of upstream prevention notion, then you've got to be, in a sense, innovative to think about what are these root causes that we need to get ahead of to be able to address as we move down the line. And so our Board of Trustees took the risk and used the disruptive innovation model, and we put out a request for proposals, and we funded a number of different innovations here in the Valley. We're in the second round of funding of those grants, and we're looking at some really crazy new ideas of how do we look at these entrenchable issues that we deal with on a day-to-day basis in a different way to improve the health of our Valley. My favorite one right now is we're looking at retrofitting school buses and looking at how we could change a school bus and retrofit them into electric using the power grids that are at their schools and eliminate the need for the cost of gas and fuel, which is a major expense for transportation for our schools. But think about those diesel school buses that are sitting out in front of schools, especially the ones that we're most concerned about in low-income communities. They're spewing out all this toxics that our kids are breathing. And what if we could eliminate that and look at that completely differently? So lots of different areas that we've looked at in disruptive innovation, but the one that we are celebrating really today is the funding that we gave to Catholic Charities and their Step Up Silicon Valley initiative to end poverty. And really, the work of Catholic Charities and leadership of Greg Kupferle, who brought with our partners, the Silicon Valley Community Foundation, folks here to the Valley to talk about this social impact bond, social impact investing, pay for success. We use a whole bunch of different vocabulary. Following me, we're going to have a vocabulary lesson and kind of look to talk about what exactly we're talking about today. But Greg brought folks together to really, again, look at this question. And so when the Disruptive Innovation grants came out, Catholic Charities applied for a grant in this area. And we were excited to not only fund the grant in terms of looking at how would Pay for Success really work here in the Valley, but secondly, we also wanted to have a very strong role. So unusual for us at the Health Trust, we really had not only given the grant to Catholic Charities, but then we also connected that to our own staff. So Todd Hansen on our staff, our COO and General Counsel, has taken a very active role in this Pay for Success process and being able to use the grant money to bring on third sector, to bring national experts in to really be able to provide that local expertise for us. Matching the local expertise with the national expertise really is the way that we've been able to get today. So today what we're suggesting is that we spend some time really understanding a vocabulary. What are we talking about here? And lots of folks have talked to me about, yeah, I went to this one talk, or I heard this one person, and there's a lot of great information happening, and there's some misinformation and some lack of clarity. So let's clarify what we're talking about. And then secondly, let's look at the national perspective, kind of something broader that we really look kind of at the bigger piece in our keynote. And then from there, let's talk about the current project and where it is now. And so we'll have the county really describe to us their thinking about where the Board of Supervisors has been in terms of looking at this as an idea of how we move forward and look at how we fund things differently, how we are accountable for our services differently, how we get results at scalable size as we move forward in our community. And then we're going to look at investors who have either thought this through or examined the question and hear from folks, especially at the local level, who have said, yes, this is a good idea and here's why I think it is. And then finally we'll hear from two members of our community to speak to the two issues that the Board of Supervisors has approved to look at within our county. So a packed day, if you will, a packed day that's all going to be condensed into the morning and lunch in order for people to really be able to come away saying, yes, I'm interested in it as an investor and in looking at this, or secondly, I not only understand this better, but now I have lots of new possibilities of how this might apply in different sectors, or how I can add to the deal, how I can add to the mix as we move forward today. We hope to have conversations at table. There'll be time for you to have conversations at lunch. There's not enough networking time built into the day, so steal it whenever you can. There's lots of incredibly smart and brilliant people in the room, so I hope you'll meet everyone and get that chance to be able to interact and engage. But again, I want to welcome you and thank you so much for being here today. It means the world to us at the Health Trust when you throw a party and actually people come. But it's a great party today, and I'm really excited for the day to begin. And so with that, I'll say again, thank you and welcome.